Okay, so first I'm going to survey the scene to make sure that it's safe. It appears to be safe. I appear to have one patient. I also appear. It also appears to be. It's snowing out. It is partly cloudy. And I have surveyed to see if there are any bystanders, and I can't see any bystanders who can lend me any sort of history on this patient. I'm now going to go through AVPU to try to um, figure out the patient's state of consciousness. So, sir, are you okay? Are you okay? He doesn't respond to any verbal stimulus. I could pinch him and do a sternum rub to see if he responds to any painful stimuli, and he's not responding to any painful stimuli, so he is unresponsive. So what I'm going to do next is I'm going to go through an initial assessment. So I'm going to do A, B, C, D, and E. So first I'm going to assess his airway. So I can do, I've already had someone come and secure his C-spine. So while someone's securing a C-spine, I'm going to do a jaw thrust, and I'm going to check his airway to see if I can hear any breathing. I do not hear any breathing. At this point, I can also apply any sort of oral or nasal airway if I find that it is necessary, or if it's a cardiac patient, I can apply a King tube. So now I'm going to go on to his circulation. I want to check two places for his circulation. So I'm going to check his wrist, the inside of his wrist. I'm going to check his neck for any pulse, and I feel no pulse. If I do not feel a pulse or something, I can also go into AED. Now that I've done that, I can go and I can survey his whole body, and I can ask myself, do I see any sort of disability, any sort of deformities? I don't see any of those. I now am going to do E, and I'm going to expose his chest by cutting off any clothing, expose his legs by cutting off any clothing. And now I can go on to my initial 90-second assessment. I'm going to start with his head, the top of his head, and all the while I'm doing that assessment, I'm going to be chunk checking, and looking at my gloves to see if there are any blood on them. I also want to check behind the ears to see if there's anything there. I want to check the facial bones, the jaw bones. When I get to his neck, I check his neck all the way down to his upper back. At this point, I would probably put a C collar on him to make sure that his neck remains stable and someone doesn't have to stabilize his spine the entire time. I can now go down to his chest. When I get to his chest, I want to assess any accurate rise and fall. So I want to check the rate and the quality of his breathing. I also want to make sure there are equal breath sounds on both sides. I can even take out my stethoscope, make sure there are equal breath sounds and equal rise and fall. I can then do my chunking, checking my gloves, checking my gloves, checking my gloves. It's at this point that I probably want to do a log roll to see if any injuries to his back. So I'm going to put one arm up, one arm across his body, like that. And then I'm going to grab him at an equal point, maybe his pockets, and roll him onto his side. I can check his neck all the way down, his back, and then I don't see anything, and then I can gently roll him back. Put his arm back. And now I can continue with chunking. Don't see anything, don't see anything, don't see anything, nothing, and nothing. So now that I've done my initial assessment, I can go on to my secondary assessment and do my DCAT BTLS. So D is going to be looking for any sort of deformities, C, contusions, A, abrasions, P, penetrations or punctures, B, burns, T, tenderness, L, lacerations, and S, any sort of swelling. So again, I'm going to start at his head. I'm feeling his head. I'm not seeing anything. Checking behind the ears again. Checking the face muscles, the jaw, the neck. This time he has a collar on, so I'm just going to check to make sure everything's okay there. I'm also going to go down and I'm going to look at his respirations again. I'm going to check the 4 abdominal quadrants. I'm going to go and I'm going to like squeeze his pelvis, see if there's any pain there. I'm going to run my hands down his legs. I'm also going to flex, see if the feet are working okay. I'm going to go down the other leg, flex his feet again. I'm also going to go down his arms, see if there's anything there. I might ask him to squeeze my hand if he can. Go down the other arm and ask him to squeeze my hand if he can do that as well. So if this was a medical patient, I would also do some sort of history. So I would do OPQRST in that case. But this is what I suspect for a trauma patient.